All right, everyone. It's pouring down raining. I mean, it is raining so much, And I'm at the public health job, and I said, well, I'm just going to let the rain die down. I have a little bit of time. It's starting to actually die down now. I'm just going to let it kind of settle down. But I'm working 2 days this week. I'm not working the retail job, and I'm working the hospital job. I'm going to talk about a little bit of an experience. When you work a job, it's not unusual to get some feedback, especially if you work at a hospital with surveys. So I've had some feedback in the past, but I recently got some feedback. And so my boss called me. And I just want to talk about the impact of past experiences if you had a toxic boss, like I did in K through 12. If you don't know me, my name is Danielle. I welcome you to Danielle's World. I'm a semi-retired nurse. I'm currently working public health contract, hospital nursing where I do CPR training, and I also work a retail job where I do inventory. And talking about past experiences, I had an experience with feedback, and I have the most wonderful bosses now, bosses plural. And the boss was doing absolutely nothing wrong, was merely had gotten some feedback and wanted to get my perspective. So I did answer the questions, and then they gave me some suggestions. Until my experience with the toxic K through 12 job, I sometimes hesitate because my past experience was if I would bring up a question, if something unusual happened, this toxic boss that I had K through 12, who I call dark triad because they show all the symptoms of psychopathy, Machiavellian, narcissism all in one. So that's what I refer to that toxic boss that I had in K through 12 as. So if I were to ask questions, share something that happened unusual, this person would immediately go to counseling, to collecting information that ultimately had me on a PIP, a professional improvement plan, that was to create documents to push me out of the job, which I did eventually resign from the job with no week's notice by email. But that past experience, I just always, when I get feedback, what I'm finding is I have to be flexible in my thinking. And that's what therapy has helped, that I actually did to heal and recuperate from this job. Family friends call me. They think that I'm not working, but I am, okay? Somebody's calling me, asking me, have you heard about their saying that nurse is not considered professional? I said, honey, they have all kind of other things on there. They're saying a physical therapist isn't professional, an occupation therapist isn't professional. Probably, I didn't see it on there, but they're probably thinking audiologist too. I didn't see that on there, but I would assume audiologist. And I said, look, if I wanted to, I just saw a job opening where the pay range is $710,000. Trust and believe I would be asking for at least 6 figures. And I know somebody over there just doing the interview. She's like getting all excited. I said, I don't want that right now. Now, what I want to say to that person is, and I was saying to my coworker, this person's asking me about, did you hear about nursing not being considered a professional degree? They're talking about nurse practitioners, nurse anesthetists, and it gets down to money. That's all it gets down to. They're saying public health. workers, people that have a doctorate or a master's aren't professional. What this person needs to be concerned about, they work at the CDC, honey, and whatever I'm saying right now, I will say to that person. So if somebody ends up seeing this that I know and they go to that person, so what? What you need to be concerned about is you're working at the CDC and there's basically two people there. You're there and you're not a professional person, and your supervisor, and I don't know what they are. There's two of you all there, and there aren't any public health workers, no doctors, no nurses, no data analysts, no researchers. I said researchers, scientists, epidemiologists, microbiologists, chemists, add everything, every other is. There's no dentists, no veterinarians, no respiratory therapists. Nobody's over there but you and your supervisor, trying to work until you're full Social Security age. I would have my resume so dusted off if I was that person. You're just gonna hold on. Oh boy. State and local government health department jobs are looking pretty good right now. Up there, ask me about what I don't care what they think of, if they think it's professional or not. Anyone that's been a nurse knows that it is a professional degree. They hold you to a real high standard. Oh, well, does that mean people that a nurse I go to is not going to have a degree? I just said, Lord, spoken by a person that doesn't have any kind of nursing degree. Just like, friend, just stop. Some people just want the drama. What you need to be worried about is only you and your boss is over there, okay, at that CDC job. You just want to hold out until you're full Social Security age. I would not be doing that. I'm heading to the hospital job, everyone. It's the day before Thanksgiving, teaching one class. Nurses are very marketable. They got all excited when they heard the six figures. I said, no, friend, I'm semi-retired. I'm on Social Security benefits, okay? Widow benefits. And part of that is until you're full Social Security age, you can only make a certain amount of money, okay? So you have to be okay with that certain amount of money. The thing is, this person isn't okay with the certain amount of money that you're allowed to make. And so what I say to people like that is, if you want to semi-retire and be on Social Security benefits, you have to be okay. The amount you can make right now is less than $24,000. You might as well just go ahead and say $23,000. Y'all, the openings, it has not changed. The problem is, which I was saying to this person, and I'll say to you all, is people like nurse practitioners, but the big issue is people that are nurse anesthetists and people that are nurse midwives. A lot of times it will take more than $100,000 to finish that whole program. And people will say, oh, well, you know, the tuition doesn't add up to that. But think about the expenses, household expenses. Someone may need to quit a job or take a part-time job, and they use that money to help with living expenses. A lot of the nurses have to travel from one state to another and keep their house, all those expenses. That's the reasons people go past that $100,000, okay? It has lots of impact. I gave that example. And let's not forget about, I'm not going to get into the education part where they're talking about doctoral education because I'm not an educator. I'm not a teacher, all right? But I'll talk about the public health. There's people that are prepared at the doctoral level for public health, researchers, professors, etc. Specialty training in biostatistics, infectious disease. They're not considered professional. We have the physical therapist, and the trend is for physical therapists to be prepared at the doctoral level. Emory University, I believe they have physical therapy, and they were one of the first the physical therapists were coming out doctoral trained. I believe that that's the minimum requirement now. So they're not considered professional. And then we have people like occupational therapists. I already said physical therapists, speech therapists that might get some advanced certifications. They're being impacted. Audiologists are prepared at the doctoral level, and they're not considered professional. I honestly would look at the money trail, and for a long time with nurses, there's this prescription writing debate for public health. But I mean, they're working on defunding the CDC too. You have to really think about the money trail. And honestly, I'm speculating. There are some people from that administration before Biden that I think were really kind of petty and upset in regards to what happened during the public health events of 2020. The United States was looking real bad. Petty about what happened and wanted to get back at the public health organizations. Why else would there be a directive that all the groups that were formed where World Health Organization and the Center for Disease Control, there were working groups. There was a directive from, it might have been Health and Human Services, to tell the CDC to get rid of all those groups. The other thing I noticed when I was told to take a class on COVID-19, and it was created by the World Health Organization. They got rid of that link on the CDC. Then we have the West Coast Health Alliance with California, Oregon, Washington, and Hawaii. In Georgia, the CDC, Health and Human Services, should people get the COVID vaccine? You have one answer there, and then you go to West Coast Alliance, and they have a different answer. Alleged. That's really what's been going on in public health. It has been interesting to work in public health during semi-retirement with this grant, and the grant funding was cut off, but this job I'm working for, there was an extension, so I'll be working, it'll end during the springtime. The class is over, yay! The class is over. That one co-working place, there's one that's near Ulta and Bath and Body Works. This is just like, woo! You can go get something to eat, go hang out the co-work, go